Well, hi everyone, this is Amy Dolgen. Welcome to the webinar. We're glad you're here. I'm one of the technical assistance providers at ICAAP for the We Choose Health Baby Friendly Hospital project, and we're so glad that you're here with us for today's webinar. As you know, the Illinois chapter of the American Academy of Pediatrics, ICAAP, is an organization of approximately 2,300 pediatricians in Illinois. ICAAP's mission is to promote the right of all children to live happy, safe, and healthy lives, and to ensure children receive quality medical care from pediatricians, and to assess, access, and serve the needs of its members. As part of its mission, ICAAP conducts advocacy activities on behalf of children, families, and health professionals in Illinois, provides continuing medical education and other resources for pediatricians, pediatric specialists, and other health and child care providers. The collaboration with other state organizations and agencies on programs and projects that improve the health and well-being of children is also part of ICAAP's work. The Baby Friendly Hospital Project falls under the umbrella of the Obesity Prevention Initiative at ICAAP. The project is part of the Illinois Department of Public Health's We Choose Health initiative, which is made possible by funding from the Centers for Disease Control and Prevention. As part of the We Choose Health Baby Friendly Hospital Project, ICAAP provides technical assistance to the grantee communities and the local hospitals they're working with to promote breastfeeding and become baby friendly. Beth Seidel and I provide technical assistance at the individual, hospital, and county levels to help grantees and their partners work towards baby friendly designation. Today's webinar will be given by Beth Seidel. As you know, the We Choose Health Baby Friendly Hospital Project is a strategy that not only supports hospitals as they work towards baby friendly designation, but also focuses on developing a strong partnership between the hospital and health department to strengthen community breastfeeding support. The webinar will focus primarily on the role of the health department in this project. An overview of the 10 steps to successful breastfeeding and the 4D pathway to baby friendly designation will be given, and additionally, ideas will be shared about strategies that health departments can implement to collaborate with the hospital and create a baby-friendly community that will best educate and support local breastfeeding families. Beth Seidel has been a lactation consultant for nearly 16 years. She currently works as a consultant with the ICAAP's We Choose Health Baby Friendly Hospital Project and at Pekin Hospital, one of the baby-friendly hospitals in Illinois. She was instrumental in Pekin Hospital's efforts to obtain baby-friendly status and continues to manage all aspects of maintaining certification, in addition to being the hospital's main lactation consultant for both the inpatient and outpatient programs. I'm going to hand the microphone over to Billy Kalb now, also from ICAAP, and he'll explain a bit about the logistics for the presentation and the question and answer session at the end.
Thanks very much, Amy. Hi, this is Billy Kalb from ICAAP. I just want to mention real quickly that we will be taking questions at the end of the presentation, so if you could hold all your questions until that point, we would appreciate it. At that point, you can enter your questions via text through the GoToWebinar interface. You can also, if you're participating by phone or with a microphone on your computer, you could raise your hand within GoToWebinar and we can call on you. And then you can ask your question out loud. Again, please hold any questions until the end. And thank you for your patience with that. I'm going to turn it over to Beth Seidel now. Thanks.
Thanks, Billy and Amy. And I want to thank all of you for joining us today. I'm honestly really excited about the topic that we're talking about. The partnership between the health departments and the hospitals is something that is really strengthening in this project, and I appreciate having the opportunity to talk to you all about that today. First thing though, Amy mentioned that I also work at Pekin Hospital in addition to working on this project, and I just want to mention thank you to all the people who have sent me emails, because yesterday when I opened my email, I had many emails of people asking if we're okay over here. I'm sure that all of you who are watching the news knows that we got hit by 2 really significant tornadoes, and one of them did hit Pekin. We lost about 150 homes. I think that there was some footage on the news from one of our moms on our floor at the hospital. We are on the 8th floor of the hospital, who took some video during that. The hospital is fine. We know a lot of people affected by this, and of course our friends in Washington were not nearly as lucky. But thank you so much for your concern. So I want to talk first a little bit just about the history behind the Baby Friendly project. This project is, comes under the CDC's Community Transformation Grant, which focuses on improving the health of communities. So they are the primary funder for this project. And then IDPH here in Illinois is our grantor. And those funds are being put into the We Choose Health program here in Illinois. The way that this works, I've had a lot of questions over the months about how were grantees chosen. Was communities applied for this We Choose Health funding, and then when they were accepted for it, they were able to choose different strategies, all geared towards improving the health of the community. One of those strategies was Baby Friendly, and at the time of the original project, 3 grantees chose Baby Friendly as a strategy. And those, it was Clinton County, who is a compilation of 14 different counties making up the South Central Illinois Health Coalition. They had 6 hospitals in their area that they were conducting outreach with. And then Whiteside and Lee counties, they did get 3 hospitals to commit to the project in the early phase of it. And then Logan County was the other grantee involved in the original project. And they had 1 hospital who ended up not being interested in moving forward with Baby Friendly. The project took on a different face several months into it when enhanced funding became available for it. And ICAAP was the technical assistance provider in the original project and continued to be the technical assistance provider, but we also reached out directly to the hospitals at that point and let them know that funding was available directly to them and that technical assistance was going to be available to help them get through that baby-friendly process. And we had 11 more hospitals join the project at that time. ICAAP subcontracted directly with those hospitals, and then the health departments were asked to support their hospitals. So some of those health departments, obviously because we have 8 grantee health departments now, some of those health departments had obviously not chosen to pursue Baby Friendly as an early strategy. But then when their hospital expressed interest in taking advantage of this funding and working towards Baby Friendly, the health departments were asked to come along in that endeavor. So there are some unique things about the Baby Friendly strategy. This is what our grantees look like now. We have 8 county grantees, but we do have more actual physical counties than that where our hospitals are. We currently have 15 hospitals, and as you can see, they are really spread throughout the states. So why is breastfeeding even a focus of We Choose Health? Well, breastfeeding is a public health priority. The evidence to support the health benefits of breastfeeding are really indisputable, but I think that a lot of people don't realize that not only does breastfeeding make healthier babies, but it also contributes to the health of the mother and our community across the whole lifespan. So not only are our babies healthier, our mothers healthier, our preschoolers healthier, but our senior citizens are as well. So the benefits of breastfeeding last a lifetime. Breastfeeding is also a measure for obesity prevention. And it's definitely a community need. We have many, many women who are choosing to breastfeed, and we're finding more than ever that their success is really a community effort. So certainly it is something worth looking at when we are trying to improve the health of the community. I always say breastfeeding lays a foundation of health, and everything else is built on top of that. So should we be putting a lot of energy into promoting and sustaining breastfeeding? We absolutely should. So why baby friendly is part of that? Why can't we just promote breastfeeding and try better to support our breastfeeding mothers? One of the focuses of baby friendly, and I'm going to talk about the 10 steps to baby friendly here in the next couple of slides, but one of their focuses is really improving community support for breastfeeding. Baby friendly makes hospitals accountable for their activities. We could very easily say, okay, all of the hospitals in Illinois, we're going to help you to ramp up your breastfeeding support, and we're going to hope that you start rooming in, that you do skin-to-skin right after birth, that you're not giving babies pacifiers in the first month of life. But if we don't have that accountability from the hospitals, we really don't have a way of knowing what they are doing. So one of the things about Baby Friendly is we have quality improvement projects that we do every year that keeps us accountable. We have to keep reporting to Baby Friendly that, yes, this is what we are doing. We keep training our staff. At my hospital, Pekin Hospital, this couple of weeks right here, we are doing a training that we do every year to help improve our staff's skills on breastfeeding support. It is that important to us. Unfortunately, there are practices in hospitals that are actually barriers to breastfeeding success, and Baby Friendly aims to remove those barriers. And then from the hospital vantage point, when you have staff who are delivering this excellent type of care for breastfeeding and bonding to their families in the community, it improves the hospital's image and it improves their branding. The hospital gets a good reputation of, you know what, that hospital over there in Jackson County, they're doing an awesome job of supporting breastfeeding. I want to go there and have a baby. So it's good for the community, good for mothers, good for hospitals. I always say that society benefits from every single baby who is breastfed in so many ways, and Baby Friendly really supports that. The Baby Friendly practices are based on 10 steps to successful breastfeeding, and I've kind of simplified them here. I'm really going to present them in kind of a framework of how they are practiced in the hospital. So they're not going to be word for word the 10 steps that you might see on the Baby Friendly website. But the first one is that all hospitals should have a breastfeeding policy based on these 10 steps, and that is a mandate in the state of Illinois now for hospitals as well. But all staff who works with moms and babies need to be trained in breastfeeding support. We want to educate moms about the benefits and management of breastfeeding prenatally. We want to initiate skin-to-skin immediately after birth and keep that uninterrupted for a breastfeeding baby until they have that opportunity to feed for the first time. But skin-to-skin is not just a breastfeeding thing. It is also very, very beneficial for any baby, and I'm going to talk more about that later. Another one of the 10 steps is to maintain lactation if mom and baby are separated. So if baby has to go to a NICU, if the baby is premature, we still really want to promote breastfeeding and help that mom to be successful. Step 6 has to do with breastfeeding babies exclusively unless medically indicated. A lot of these steps actually have a sub-step, and this is where the not accepting free formula comes into the Baby Friendly pictures under this exclusive breastfeeding step. Step 7 is moms and babies room in together in the hospital. Step 8 is to feed babies based on hunger cues rather than on the kind of old mantra that we have of feed babies every 2 to 3 hours. We're really teaching moms, whether they're breastfeeding or bottle feeding, to feed their baby based on the information that the baby is giving to the mother. Step 9 has to do with giving no pacifiers to babies who are breastfeeding, and also no artificial nipples. So when we supplement babies, we don't use bottles if they do need to be supplemented either with breast milk or formula. We have other ways of feeding them. We use little cups, little spoons, syringes, little tubes. And then the 10th step, which is where everybody on this call comes in, is to refer mothers to sources of community support. That might be a hospital-based breastfeeding group. It might be a support group within churches, within the health departments. So there are so many ways that we can make community support work for mothers. So why is the hospital important to breastfeeding success? I have a lot of people who will say to me, you know what, I really think that it's up to the mother. If she really wants to breastfeed, she is going to breastfeed no matter what. It doesn't matter what I do in the hospital. It doesn't matter what I do in the health department. It doesn't matter what I do in the physician's office. But the evidence tells us otherwise. We do know that the experience of the mother in the hospital is so very important. One thing that I have learned over almost 17 years of being a lactation consultant is that if a mother is not successful in the hospital, she really holds the hospital accountable for that. So this is an opportunity for us to step up and own that and say we can do better. We can support breastfeeding mothers more effectively. We know from the evidence that the more of the 10 steps that are practiced, the better the mother, the better her success will be, the longer she will breastfeed her baby. And also very simply, when a mother goes to a hospital to have a baby, she expects a well-trained staff. She expects that that staff is going to help her have that baby, that they're going to be able to help her take care of herself and her baby. Just like when I go anywhere, when I went and bought my new computer at Best Buy, I had a complete expectation that the guy who helped me at Best Buy was going to be able to help me choose the right computer. Our consumers in the hospital are no different. They come expecting us to be able to help them effectively and to know how to do this, to have this skill set of supporting breastfeeding. One of the most common questions that I get when I'm talking about baby friendly is, well, what does all of this mean for the mother who chooses to formula feed? So I want to talk about that. Formula is supplied by the hospital. There's a lot of misinformation out there that, oh, if a mother's going to formula feed, she won't be supported in that, and she's going to have to bring her own formula. And that is not true. The mother who is formula feeding, her experience in a baby-friendly hospital is no different from her experience in a hospital that's not baby-friendly as far as her getting that formula. It's given to her just the same way that it is in every other hospital. So mothers don't have to be worried that they're not going to be able to get formula. But baby-friendly practices are good for every mom and baby. So there's a lot of things that we do in a baby-friendly hospital that have a lot more impact than just on breastfeeding. And we're going to talk about some more of those later. The reality is that only 25% of our mothers are choosing to initiate formula feeding in Illinois. So that means that 75% are choosing to breastfeed, and we need to support all of those mothers with really a special focus on meeting the needs of the majority and knowing how to help them. We know that 60% of women in our country are not meeting their breastfeeding goals, and I think we all have to own that and realize that there are things that we can be doing to better support breastfeeding mothers, whether there are patients at the hospital or the health department, or it's our sister or our niece or our coworker. We all benefit from every baby who is breastfed. Some of those benefits that are good for moms and babies, whether they're breastfeeding or not, are, first of all, rooming in. All babies benefit from being with their mothers. Whenever I'm talking about rooming in to anybody who really doesn't understand it and they think that it's just a breastfeeding thing, I always say, boy, the babies who are being fed formula deserve no less to be with their mother. So this is something that is universal. That skin-to-skin contact is another thing. Moms and babies staying together. There is tremendous benefit to both the mom and the baby. This has nothing to do with breastfeeding when you're just looking at how much that baby deserves to be with their mother. The baby who's being formula fed doesn't think, well, that's okay if I go to the formula, if I go to the nursery, because I don't really need my mother anyway. They all need their mothers equally. One of the other things that Baby Friendly really focuses on is teaching safe feeding to mothers who are choosing formula feeding and mothers who are choosing breastfeeding. So that is a big part of Baby Friendly also. So how do we create this Baby Friendly community? Because that really is what we need to do. We're not just creating baby-friendly hospitals. We have several partners within our communities. We have physicians, all healthcare workers really, the health departments. We have breastfeeding mother support groups, like we have one at Pekin Hospital. I know that a lot of our hospitals in our project are also starting support groups. A lot of WIC departments have support groups, and then of course there's Breastfeeding USA and La Leche League. Our families are in such a fantastic position to support breastfeeding mothers. Our friends and employers. We know that breastfeeding mothers have a definite benefit to their employers. Their healthcare costs are less. They are at work more often. So we have all of these partners who have a stake in supporting breastfeeding. So where does the health department fit in? And one of the questions that I've had is, this is a strategy that maybe doesn't really have all that much to do with the health department. I'm not really sure how we fit into this. Isn't this just a hospital thing? Well, I think that I really already kind of addressed that when I talk about community partnerships and how important it is for us to support breastfeeding mothers. But one of the things that health departments do, one of their goals, is to improve community health. And WIC certainly is very good at promoting breastfeeding. And it's just a great example, supporting breastfeeding, of how a health department can contribute to community health. Supporting breastfeeding is also a cost reduction in communities. The more women are breastfeeding, the healthier their babies are, so the lower their health care costs, and the less the government is having to spend on formula for the WIC programs. Consistent messaging is certainly an area that the health departments can help with. The health departments have more interaction with a lot of the moms in the community than the hospital does. So they can certainly help us to be delivering a message prenatally that is then heard consistently in the hospital and then back in the health department after the mom is discharged from the hospital and goes there for follow-up breastfeeding care. So I know as a hospital employee, I certainly look at the health department as my education partner. In my little utopian breastfeeding world, I really can only imagine how wonderful it would be if we had that consistent, supportive community where breast milk was valued as the first choice of food for babies, one of the things that I always say is we need to make breastfeeding important. And the more players we have, the more partners we have in our community using their voices to say breast milk is important to the health of this community, the more successful we will be with supporting our breastfeeding families. So is this a turning point for breastfeeding in Illinois and baby-friendly in Illinois? Well, we can look at the history and see that it really is. St. John's was our first baby-friendly hospital, and they were the only one for the first 9 years. And then Pekin Hospital was the second one. We were designated in 2006. So then for another 6 years, it was just us and St. John's. In 2012, Little Company of Mary became designated. And then in the beginning of 2013, we had St. Mary's in Decatur. So you can already see that we've had a doubling from just Pekin and St. John's being the lone baby-friendly hospitals. Now we have over 30 hospitals in Illinois working towards baby-friendly, which to me is so very, very exciting. So how can we make this partnership easy? How can we make it work? I'm going to be honest with you. When I first started in this program back in March, I was not sure how the partnership between the hospital and the health department was going to work. But I have learned from the health departments in this project who are successful in creating this partnership how that is going to look, and I'm so excited about that. First of all, we have our WIC programs in our health departments who are already promoting breastfeeding. And the health departments who are making this work well are using the resources and the staff that they already have in the WIC program to create this partnership with the hospital. It just seems to be a natural collaboration that is occurring with these health departments who are going through the WIC programs. The WIC programs are doing a fantastic job already of promoting breastfeeding. We're really just enhancing what they're already doing. They are already doing education. They are already through peer counselor programs and the nurses who go out to see the moms. They are already supporting breastfeeding. And they already have a system of follow-up in place. You know that one of the things that we talk to moms about in our hospitals is, you know, if you're on the WIC program, do you know who your peer counselor is? Are you going to let her know that you have delivered? Because that's going to be an important part of your support network. So these things are already happening in our WIC programs, and those health departments who are putting the Baby Friendly Project in the WIC program really seem to be doing a fantastic job. I have gotten a lot of ideas from our health departments and how they get on the same page with the hospital, and I just want to share some of those ideas and then some things that we've done here in our community as well. Heather Ludwig from the Champaign-Urbana Public Health District, she spoke about sharing the education resources between the hospital and the health department. I think that Heather, I don't know if you're on the call, I hope I'm not embarrassing you, but she talked about how she asked the hospital to see the education pieces that they're using, and she shared her education pieces. That's an important part of making sure that we are all on the same page. We need to know what the other group is saying so that we can be consistent. Inconsistent messaging is one of the biggest complaints of moms when they talk about breastfeeding not going well for them. They go to the hospital, they go to the health department, they go to their physician's office, and they hear different stories there. They don't know what to do. So it's important for us to share our education resources. Usually there are breastfeeding classes at the health department and at the hospital. Attend each other's classes. That'll really give you an insider's view into what the moms are being taught. And if you find that there's inconsistencies, talk to one another about that. We want to be on the same page, and we want to all be providing evidence-based information. So perhaps we need to work together to keep current with all that evidence. Shadow each other. I know that Heather talked about going over to the hospital to shadow the lactation consultant there for a day. We've done that here in my community as well, and I can see a lot of benefit to the hospital folks going over to the WIC department and shadowing them, because these are the people at the WIC department who are continuing to support our mothers in many communities, more so than the hospital is. So it'll just help us to know what all is available in our community. And then we have some of our health departments who are on task forces, breastfeeding task forces with the hospitals, or they have created community coalitions that meet monthly. Just a couple weeks ago, I was fortunate to be able to go to Lee County to attend one of their community coalition meetings, and it was just so great to see in the same room physicians and office staff and hospital people and health department people all working together. So just great examples of how we can work with one another and collaborate effectively. I want to talk about education as a piece where health departments can really help to promote baby-friendly. It helps the hospital when our mothers come to us knowing what to expect at a baby-friendly hospital. I know that most WIC programs do prenatal education, and this was one of the objectives that our health departments were able to choose from in their work plans for their We Choose Health grants for year 2, is incorporate baby-friendly education into their prenatal education. I don't know about other hospitals in Illinois, but we get decent turnout at our prenatal education, but not anywhere near the numbers that I would like to have. And I know that there are more women in our community who are being educated prenatally by WIC than they are at our hospital. So we have these women ripe for knowledge. They want to learn, and this is the time to teach them about baby-friendly. I'm going to talk about some of the specific things that you can educate them on here in a couple of slides. But another thing that we can really focus on in this prenatal education is, why is exclusive breastfeeding important? A lot of people, healthcare workers included, don't know that there's a benefit to exclusive breastfeeding. They don't know that that early supplementation in the hospital or at home, if it's not needed, can actually interfere with breastfeeding success. And we can share with mothers how they can increase their breastfeeding success in the hospital. To support the hospital and health department efforts for education, ICAAP, through this project, has supplied you with some resources. The picture on the left are the resources that we supplied to the health departments, DVDs, books, tear sheets. On the right is the stack of books, about $600 worth. In this picture, there's about $1,000 worth of breastfeeding materials. But the stack on the right were the resources that we made available to the hospitals. And I know that some health departments and hospitals are sharing these resources. So please do that. Another great resource for education, for studies, for references is the Baby Friendly USA website. I'm sure that probably all of our hospital folks have perused this, but people who are listening from health departments, physician offices, please take some time and look at the Baby Friendly USA website. They have great resources on there. Everything that I have taken, all of the obesity prevention that I mentioned, and I'm going to talk about rooming in and skin to skin and those benefits, I took all of that from bits and pieces in this AAP statement on breastfeeding and the use of human milk. And the reason why I did that, and I'm not using any other resources today, is that I really wanted to impress upon everyone that this is a great document that's highly referenced, that you can start, that you can use as a starting point for a lot of the baby-friendly practices. It's got great information about why the 10 steps to successful breastfeeding help to promote breastfeeding. And you can pull from this document those references to use in your own education. So if you're thinking, gosh, I don't have all of these breastfeeding studies available to me, this is your starting point. It's referenced. You have tons of breastfeeding information available to you here. This is the 2012 statement, so make sure that when you search for it that you get the 2012 statement. So what are some of the reasons to do skin-to-skin in the hospital? This is what would be really beneficial to include in that prenatal education. Simply put, it's the best transition for the baby. It's what the baby expects. The baby expects to come out and not be separated from his mother. Just very simply, I'm not going to go into a lot of detail here. He is kept warm with his mother. He's colonized to his mother's bacteria. The first bacteria that he comes into contact with in life should be his mother's, and that will make him healthier across his whole lifespan. And skin-to-skin is great for the mom too. I love this picture that a mom shared with me, because I feel like you can just almost see the oxytocin just floating through her brain, and how good that skin-to-skin feels for both her and her baby. This is just a quote from a mom who did skin-to-skin, and really about her experience. And you can see that she's just talking about how important it was for her. She had to have a C-section. That was not her plan, and how skin-to-skin kind of made up for that. So these are things that we can do in the hospital that help to improve the mother's experience. This is a mom who stayed skin-to-skin with her baby for almost 2 hours. So there is no limit to how much skin-to-skin that you can do. And here at Pekin Hospital, we delay weighing and measuring our babies, but we do everything else that we have to do: vitals, the vitamin K shots, the ointment for the eyes. We do all of that while the mom is holding her baby. We put the bands on, we're assessing the baby, so there's so much benefit to immediate skin-to-skin. Another quote from a mom whose baby went skin-to-skin with her right away. Moms that I've talked to who have had skin-to-skin after one birth but didn't from a previous one really are profoundly affected by how different of an experience that was for us. And if the baby is breastfeeding, of course it is the first step to getting the baby to the breast and initiating that first feeding. But I think that these words, the mom says, I really think that doing this helped me forget all of the pain. It was the most amazing bonding experience. So they're focusing on different things in these quotes than just breastfeeding. So again, this is not just a breastfeeding thing. Rooming in is another one of the 10 steps that really benefits the hospital and the mom when they know about it before they go to the hospital. In the middle of the night when the baby is fussy is not the time to initiate a conversation with a mom about rooming in. So health departments can really help to support the hospital by focusing on this in their education. Mom and baby stay together at least 23 out of 24 hours in a baby-friendly hospital. 80% of moms is our goal. Well, really our goal is 100%, but 80% is kind of that marker that baby-friendly wants to see. So of course we have exceptions to this rule. If we have a mother who is just not capable of caring for her baby, or a baby who's not stable, of course those babies are in the nursery. But this staff helps the mother in her room at night. So it's not that we're not helping her. But rooming in definitely increases our rates of breastfeeding. It is great for family bonding. It reduces weight loss in babies, reduces bilirubin levels, so the rates of jaundice in babies. And we always encourage a support person to stay with mom. That's a conversation that we have with mom while she's in labor, and definitely the health departments can have with mom when they're preparing them for what it's going to be like to deliver at a baby-friendly hospital. This quote here was pretty telling from this mom, when she says, the hospital we gave birth at only does rooming in, so we knew we wouldn't have any problems with the nurses. And it always makes me sad to know that a lot of moms are worried that they're going to have to fight to keep their baby with them. And then this quote again, it made us feel like we were completely involved in this birth. Mothers who rooming in usually really love it. Yet another mom who, talks about how she didn't want to part with the baby. And this is a dad actually doing skin-to-skin, which we see a lot of at our hospital as well. But, she says she waited 9 months to see her baby, and she wasn't about to, pass the baby off to a stranger. And actually, this was a mom who had a C-section. So reasons for exclusive breastfeeding. Why is that important? Well, colostrum, that early milk, primes the baby's gut and really helps to establish his immune system and his digestive system. Exclusive breastfeeding helps to establish the milk supply. Breast milk is designed for frequent feeding, so we expect babies to be feeding a lot. They get small amounts in the first couple of days, which is really good for practice for both mom and baby. Reasons for not using artificial nipples. Definitely when moms come to the hospital ahead of time knowing that we don't use pacifiers, we don't use artificial nipples, again, that's very helpful to the hospital. But pacifiers interfere with the establishment of milk supply and really interfere with the baby getting food. So that is important information to let moms know about why we don't use pacifiers in the hospital. Something else to focus on in prenatal education with moms is where in the community can they go for help after discharge. The first nights after discharge are very, very important. We know that those are prime risk times for supplementation. So this is certainly something to talk to moms about, but it's also something for the hospital and the health department to collaborate with. What is the best way for moms to get follow-up support after discharge from the hospital? Do we have support groups in our community? Is somebody doing a follow-up visit, either the health department or the hospital, right away? How can our peer counselors contact moms right away? So again, a conversation to have with the mothers and the hospital. I already talked a little bit about developing community coalitions as something else that the hospital and health departments can do together to support breastfeeding. So if this is something that you don't have in your community, it would be a great thing for the health department as that promoter of community wellness to take the lead on. We have some great success stories with our health department grantees in Illinois already. Jackson County is doing quarterly education opportunities where they're bringing together health departments, hospital folks, medical office staff, and physicians to work on developing breastfeeding skills and consistent messaging. I think that is a fantastic thing that they are doing. I talked about Whiteside and Lee County, who are having their monthly meetings, and things that you can do in those meetings. You can share ideas for what's working in the hospital, share your education strategies, how are you making practice changes, and talk about your challenges. If you had a really bad month with your skin-to-skin rates, then talk about that and brainstorm as a group as to how you can make those changes in your community. Already talked about Champaign working with their hospital and collaborating on education, and this is just a picture of some of our folks from Champaign and McLean counties. I know that those two health departments are also in contact with one another, supporting one another. So don't forget about that health departments can reach out to other health departments to find out what's working there, to brainstorm with them. It doesn't have to just be the health departments and the hospitals working together, but the health departments and the health departments and the hospitals and the hospitals. It's one of the great things about this project is we can bring all of these community partners together. Just want to toot Champaign-Urbana's horn a little bit here, because one of the great things that happened, and I mentioned Heather Ludwig, and this is her along with somebody from President's Covenant and someone else from the health department dancing at one of the trainings that we offered for the project participants this summer. The health department did such a fantastic job of collaborating with the hospital and really making it known in the community that we are working in Champaign-Urbana on baby-friendly, on supporting breastfeeding, that it caught the attention of another hospital in Champaign County, Carle Foundation Hospital, who decided that they wanted to come to the table as well and participate in the project. So just a little added bonus of bringing a 15th hospital into our project because of the work in large part by the Champaign-Urbana Public Health District. So what do the hospitals have to do for ICAAP and IDPH in this project? Well, we subcontracted with the hospitals through the end of September. So that subcontract is over. We are going to continue providing technical assistance to the hospitals. I am in contact frequently with the hospitals. They know that I'm always available for them. But the only thing that we are asking of the hospitals moving forward is a quarterly report. It's a one-pager. All of our hospitals have done it twice now. We just want to be able to just kind of monitor their progress and see how they're doing and identify any barriers or any opportunities for us to help. So there's just that one report, and we hope that they're going to continue to request assistance from ICAAP. So how about the health department? What does the health department have to do as they take on this baby-friendly strategy? Well, at the very minimum, there is a quarterly report that is due from the health department. The health department does not have to be collecting any kind of reports from the hospital. ICAAP is going to be collecting those from the hospital. So the health department, they have quarterly reporting on all of their strategies that they do for IDPH, and they are going to be reporting on any milestone activities, on their work plans. There's a one-pager that they will be submitting to UIC that is very similar to the one that the hospital does, which just really is a lot of check boxes. It can be done in about 10 minutes, but that is at the minimum what the health department can do. They check in with the hospital quarterly to find out how they are progressing and just report that back to IDPH. And along with, like I mentioned, their work plan activities. So that's the minimum. And then if the health department has chosen to do any of these things that I've spent the last 45 minutes talking about, to incorporate baby-friendly into their education, in creating a community coalition, in just partnering more with the hospital on education, then those are all things that you're just going to report on. But again, a lot of these things are activities that are already being done by the WIC program, and it just seems to be working so well for the health departments who have just enhanced that a bit. The benefactors of all of this collaboration are breastfeeding moms and babies ultimately. We all really here have a shared goal. We want to promote breastfeeding, we want to support breastfeeding families and help families achieve their goals, because that's going to improve the health of the community, and that is the goal of, I'm sure, everyone on this webinar. I just want to give a quick example of how a breastfeeding community works. We have a lot of you have heard me talk about this. We have a local Facebook group here in Central Illinois where I am. It's called Central Illinois Breastfeeding Moms. And in the middle of this tornado, and we have had moms who have been affected by this. We still have people with no electricity. We have moms who have lost their homes. And I have been so, I don't know, it's just warmed my heart, I guess, to see how our community is coming together via this Facebook page and via the lactation consultants that we have in this community supporting these moms. There have been numerous, dozens and dozens of offers of freezer space for moms who exclusively breastfeed, or working moms who have a stash of breast milk in their freezer and are at risk of losing that. This is a picture of a mama who exclusively breastfeeds. I'm sorry, who exclusively pumps. So for her, a power outage is a disaster. And it's just been amazing to see our community here for breastfeeding support working to support our mothers in a disaster. To me, these are always things that I have read about, supporting breastfeeding in a disaster, and I feel very fortunate that I am seeing how that works well now that that community is my own community. So again, the community coming together to support breastfeeding, definitely worth it. At this point, I'll take some questions.
This is Billy again. I just want to mention again that if you have questions, you can ask them by typing them into the questions box in the GoToWebinar interface, or you can raise your hand and be called on and ask a question out loud if you're calling in by phone or have a microphone attached to your computer.
And if there are no questions, which somebody has to have a question, I would love it if anybody on the call has some success stories that you would like to share with us on how you are partnering in your community.
Okay, we have a question from Linda Smith. Does IDPH have a policy on infant feeding in emergencies? This would be a good addition to We Choose Health.
Oh, that is a great question, Linda. I am not sure if IDPH specifically has that. So I will check into that, especially in light of what is happening right now. Thank you, Linda.
Here's a question from Kathleen Ireland. How was this project initially shared with the community?
Hi, Kathy. I don't know if you were on in the very beginning of the webinar where I talked about the history of We Choose Health. You know, unfortunately, you know, we are in Peoria County, and Peoria County was not eligible for this funding. You know, so if you're thinking, wow, this isn't anything that I knew about in the hospitals here in our area, we're not aware of, it's because our community was not a We Choose Health funded community. So when we contacted the hospitals, when the enhanced funding became available, we at ICAAP directly contacted hospitals in communities that had We Choose Health grants. And unfortunately, Kathy, that was not us.
And perhaps a related question here from Michelle Beckstrom. Why isn't Methodist or OSF going baby friendly?
Yeah, Michelle, does that answer your question? I've had a lot of hospitals call me, wanting to know why they were not eligible for this. And like I said, the source of the funds was the We Choose Health grant. I think it's 21 or 22 communities in Illinois were recipients of those grants. And I think that an important thing to take away, from this, for those of you who are not in We Choose Health funded communities and are listening in, and first of all, thank you so much for joining us, is that these are all things that we can be doing in our communities as well. We don't have to, have this funding. We can still be supporting our hospitals. We can still be incorporating the 10 steps to successful breastfeeding into our prenatal education, whether we're in a funded health department or not. Any other questions? Or is there anybody from any of our health departments who'd like to share a success story? Maybe not.
Well, this is Amy. It sounds like, was there anybody else with questions? It sounds like we're pretty much done with the webinar. Thank you all for coming. If you do have any questions, please feel free to reach out to Beth or I at ICAAP. Everyone should have our contact information from the promotion of this webinar. And if you don't, my email is adolgin, ADOLGIN, at illinoisaap.org. So give us a call or an email, and we will be in touch. And I'm so glad that you were all on the webinar. Thanks for joining us.
Thank you.
Thank you.